The Department of Education in the last, not this past budget session, but the one with legislative session. Sure, please. The legislative session in 2018 through the Marjorie Stoneman Douglas Public Safety Act appropriated a lot of funding to schools for behavioral health services. So within the different communities, there's a need for coordination between everything that everybody's got going on. And so there's a lot of work being done at the local level, coordinating between the schools and all of the other different funders. Agencies for Persons with Disabilities, which all of y'all are familiar with. Department of Health Children's Medical Services, which runs the Children's Medical Services Program and they've got a managed care plan that is now with WellCare for the Medicaid as well as the Healthy Families. The Department of Juvenile Justice, Department of Corrections are also involved as funders in some cases. And when we talk about the behavioral health system of care, with behavioral health, we mean mental health as well as substance use disorders. So that's what we talk about with behavioral health. So I'm going to talk just a little bit about ACA and then the Department of Children and Families. So ACA, with the Medicaid program, in 2011, the legislature directed ACA to create the statewide Medicaid managed care program. So that rolled out, and then there was a reprocurement that happened just this last year with rollouts of the new, and in some cases the same, but plans that was December and then January and February of this year. And there's three key components. There's the managed medical assistance piece, which also includes behavioral health. There's the long-term care program for nursing home care or diversion from nursing home care. To be in that program, you have to meet the nursing home criteria for care. And then the dental program, and I think you probably all are aware that dental is very, very important. So having that broken out can be real helpful. So there's several different types of managed care plans, and those managed care plans are responsible for the determination of medical necessity for services and provision of services to their enrollees. And then you can find out more about that program on ACA's website. Like I said, I don't work for ACA, so I can't really, completely speak to their whole program, but except for kind of peripherally. What I can talk about in more detail is the Department of Children and Families. So we contract with 7 managing entities, and those 7 managing entities each have their own area that they're responsible for managing the day-to-day operational delivery of behavioral health services for individuals who are uninsured or underinsured. And what I mean by underinsured is that they may have insurance, whether that's private insurance, Medicaid, Healthy Kids, but they require services that aren't funded under that particular insurance program. Or perhaps that insurance program doesn't have a provider for that service, but maybe the managing entity has a provider. In some cases, the providers in a lot of cases, a provider that the managing entity contracts with is also a Medicaid provider and possibly a Healthy Kids provider and maybe even a private insurance provider. So in some cases, it's all the same people we're talking about. So those managing entities contract with a variety of behavioral health providers in their area to deliver prevention, treatment, and recovery services. And then they're responsible for developing their system of care and looking at what are the gaps, what are the needs, what do we not have that we need, and how can we make that kind of thing happen. And the Department of Children and Families website has more information about the managing entities. And this is a map of where the managing entities are. So we have 7 of them. We have Big Bend Community-Based Care in the northwest part and kind of central-ish north part of this state. Northeast Lutheran Services covers the northeast and down into central Florida, including Lake Sumter, Hernando area. And then Orange, Osceola, Seminole, and Brevard are covered by Central Florida CARES health system. The Suncoast and then into Polk County is Central Florida Behavioral Health Network. Over on the East Coast with Palm Beach, Martin, Okeechobee, St. Lucie, and Indian River is Southeast Florida Behavioral Health. And then Broward is Broward Behavioral Health, and South Florida Behavioral Health covers Monroe and Miami-Dade counties. And I have a list, if anybody wants it, of the managing entities, which counties they serve, and also a contact phone number if you would like some more information. Each of them have websites, which you can either access just by Googling them or through the Department of Children and Families website. And a lot of them on their websites have a list of the providers and some information about what they're doing, sometimes in addition to actually just contracting for services. Because the managing entities really do a lot for us. Anybody ever had any contact with one of our managing entities?
I work for one.
You work for one, so I guess you have some contact.
Yes.
Which one do you work for?
Central Florida.
For Central Florida?
Mhm.
Awesome. So publicly funded services. Each state agency that funds behavioral health services has a defined population. And that may be based on state requirements, it may be based on federal requirements, it may be a separate population for a specific project or a specific grant, whether that's a federal or state. And the target populations for the Department of Children and Families are defined in statute. They could be defined by the legislature for a special project, or they could be defined by the federal grant that is working that particular program. ACA, the Agency for Healthcare Administration, defines their eligibility for Medicaid covered services in their handbooks, which are on their website. So Department of Children and Families, what does statute say about who we serve? This is what Florida statute says about who we serve. Children with serious emotional disturbances or at risk of developing. Adults with serious mental illness, including those with forensic involvement, court involvement. Persons in crisis, persons with co-occurring mental illness and substance use disorders, or people that are at risk of developing those substance use disorders. So we kind of look at an array of services. And this is true regardless of whether the funder is the department, is Medicaid, is health insurance, some private insurance. In the adult mental health, and they kind of follow the same sort of track. So we have prevention, outpatient, community support, peer support, and then you get into the higher level of care of the crisis unit, short-term residential treatment, or inpatient. In the adult mental health, the highest level is our state treatment facilities, which are also commonly known as our state hospitals. In substance abuse for adult, we have health promotion, we have outpatient, community support, peer support, residential, detoxification, and then addictions receiving facilities is the highest level. Children's mental health kind of follows the same sort of track of prevention, outpatient, community support and peer support, therapeutic placements for children, and the highest level is the crisis stabilization unit or inpatient. Children's substance abuse follows the same kind of track as the adult with health promotion, outpatient, community support and peer support, residential detoxification, and the juvenile addiction receiving facilities. So a little bit about the therapeutic placements for children. From the least restrictive, we have therapeutic foster homes. And then kind of moving up in terms of restrictiveness, we have therapeutic group care or group homes, therapeutic group homes, residential mental health treatment, and then inpatient psychiatric hospital. And in Medicaid lingo, the inpatient psychiatric hospital is kind of commonly called a SIP. Anybody heard of a SIP? A couple nods, some people. And that's the statewide inpatient psychiatric program. So that's, people talk about like it's a SIP placement, but SIP is a service, not the placement. So the next thing I want to talk about are some key initiatives that we have at the department focused around services for children. We have community action treatment teams, which are commonly called CAT teams, Anybody ever heard of a CAT team? I know the managing entity people have. The CAT teams are funded solely by state funds. And we received more money last year with the Marjorie Stoneman Douglas Act to expand the CAT team services. It's not statewide yet. We every year ask for more money because we would like to have this be a statewide service. It's a team-based, family-focused, community-based services and support to youth and young adults with significant behavioral health needs and their families, with the goal of having the young people become successfully remain within the community, and be connected to their community. So appropriate referrals, there's some specific criteria, but children that are coming out of residential treatment centers can be served by the CAT team as a way to integrate them back into the community. That's pretty successful. Or we're trying to prevent them from having to go into residential treatment or deeper into the juvenile justice system. Family intensive treatment, or FIT, is similar in some ways to the CAT in that it's team-based and family-focused, but its population is much more specific. Its population are families where there's parental substance abuse and child welfare involvement. So there's been, and there's a child who's 8 or younger. So there's been an abuse report about the parent's substance use, or maybe not, but they discover the parent's substance use in the course of the investigation. And the goal of this is to try to either prevent removal or reunify, but to, in doing so, to increase the parental protective capacity and increase child safety, and decrease the parental substance abuse and instances of child re-abuse and neglect. We have mobile response teams. Has anybody ever heard of the mobile response teams? A couple of heads. The mobile response teams provide on-demand crisis intervention services anywhere there's a crisis happening. And that could be school, that could be at the mall, that could be at a park, it doesn't matter wherever that crisis is occurring. There were some mobile crisis units around the state, but we received money, again, with the Marjorie Stoneman Douglas Public Safety Act to make it statewide. So we now have 40 mobile response teams operating statewide. We have 67 counties, so there's not one per county. Some of them serve more than one county. Some places we have more than one in the county because that's what the need is in the higher population centers. And a team member responds within 60 minutes. The target population is up to age 25, although if they go out and they find that the person is 27 or 28, they're not going to say, "Oh, I'm sorry, I can't help you." But what they're trying to do is, go have your crisis on your own. What they're trying to do is to lessen the trauma, particularly because if any of y'all have ever had an experience with a child or someone who's being Baker Acted, it's very traumatic. And the police come out and they put them in handcuffs to stick them in the back of the police car when they're having a crisis and are, talking about killing themselves or hurting somebody else. And so it's very traumatic. So we're trying to lessen that, divert from emergency departments, divert from criminal justice and juvenile justice, and prevent unnecessary psychiatric hospitalizations. We've had, in the course of last 5 years, just a really big uptick in the number of Baker Acts, of involuntary commitments. And so this is an effort to try to prevent that. And so far we don't have a lot of data because the most recent teams just got started in March, but we will be, we're going to be tracking that, and we think what we're going to see is a reduction in the number of Baker Acts. We have programs for pregnant women. We've got to focus on this for pregnant substance using pregnant women. Say that 3 times fast. So we've got residential treatment, outpatient treatment with residential support, outreach, detox, child care, postpartum case management. And we're trying to expand substance use services that support both the mother and the children to increase the parental protective capacity, decrease parental substance use, and increase the children's resiliency. So around the state, we have some residential programs where the child, the newborn, can actually stay with the mom, which is really important, as long as it can be safe. To rip that child away is not a good thing for either the child or the mother. And the department is working with managing entities to reshape the system of care and to one that is recovery oriented. That instead of just kind of looking at let's treat treatment, is looking at recovery. Because we believe that everybody with a mental illness or a substance use disorder or issue can recover. And we're working on this being very family driven and youth guided. Those who are experiencing these issues are the best person to say what it is they need to help them recover. So we're really trying to focus on it being family driven, asking the youth, what do you want? What is your goal? Where would you like to be? Obviously there may be some things that a family or a youth might want that are kind of like, well, no, we can't make that be a goal. But for the most part, trying to really listen to them, to build on their strengths, because even if they're in crisis and they've got a lot of things going on and a lot of diagnoses, they still have some strengths, and let's find those strengths. Natural supports and peer support is something that we really, over the last several years, have been really working hard to expand that around the state, because we started within the substance use area and are moving now into the mental health area, but that natural support, that peer support, somebody who's been there, somebody who has lived it, maybe not the exact same experience as you, but who understands completely where you are because they've been there before. And in helping to navigate, this whole system can be very confusing. And what we're really trying to avoid is somebody calling and going, okay, I can't help you, you need to call here. No, I can't help you, you need to call there. That is so frustrating. I mean, I can't even imagine, you got this crisis going on and you have to call 14 different numbers and everybody says, I can't help you. So we're trying to kind of take some of that away. Culturally and linguistically competent, that really is speaking to meeting the people where they are, not just in terms of race or ethnicity or sexual orientation or religion, but the culture of that particular family, and really understanding them and trying to help them. And then coordination across systems and services is really crucial, because a lot of times children and youth get involved in multiple systems, and there's different kind of stuff going on in each of them, and nobody's maybe talking to each other, and you got this going on at school, and you got this going on here, and then maybe the Department of Juvenile Justice is involved, and nobody. So pulling all that together and really trying to coordinate it so that you're not having a family try to get to 14 different appointments in a week when they have no transportation. And then we're saying, well, you're just not complying. Because that's really helpful, huh? And with the adult substance abuse, we've been focusing on increasing the number of individuals with lived experience providing peer support. We've been really working hard on that. The managing entities all have somebody who's pretty much dedicated to that within their area. And in children's mental health, we've got in several areas of the state, we have collaborations with child serving agencies and providers to really transform the whole system of care within that particular area and include the family voice and choice and the better coordination of services. And one of the best ways to better coordinate services is through a framework called Wraparound. It's a very intensive care coordination model, showing really good outcomes, and it really looks at pulling everybody all together and bringing everybody to the table, and including the family, instead of this like, let's have the professionals meet and come up with a plan for the family, which is really helpful, because then the family's like, no, that's not helpful at all. So we've been providing a lot of training across the state in the Wraparound Framework, and we have been working with the Medicaid managed care agencies, and there's a lot of work at the ground level with the managing entities and providers with that as well, to be able to have Medicaid pay for that. So that's my speed presentation. Again, I'm very sorry about being late. And this is my phone number, that's my email. Anybody have any questions? I appreciate y'all hanging in here. The other thing that I brought along is, I can stick these in the back and y'all can pick them up. One thing that we've been doing, and I hope that nobody ever has to know this information, but the department has been doing a lot of work on opioid overdose and naloxone and getting that out. And we have a website called isaveflorida.com. And this is just some information on how to recognize an overdose and kind of what to do about that. Hopefully nobody ever has to know that.